Hi, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks, reporting to you from San Francisco, site of the Health Forum American Hospital Association Leadership Summit. More than 1,500 hospital executives are gathered here to talk about best practices in the field and trends in the industry. I'm joined this morning by Ian Morrison, who once again takes on role of synthesizer for the proceedings. Ian, thanks for being with me.
Matthew, pleasure.
Ian, we've got a great lineup of speakers, from good to great author Jim Collins to Clayton Christensen. Tell me, what do you think are going to be the highlights of this week's meeting?
Well, I'm really excited as always, and I think we've got an even better cast than we've ever had before, which is really hard to do. And I'm always excited to hear from Jim Collins. He's one of the greats in the consulting business and a real thinker about how to build companies that last and how to really go from good to great. And we're going to hear from him with his perspective on transformation. And Clayton, invented the concept of disruptive innovation. So, I mean, both of those as sort of business authors, I think are going to be real high points for me. But I always enjoy hearing how the big picture affects healthcare. So I'm particularly looking forward to Secretary Condoleezza Rice talk about her perspective on leadership and on change and leading in times of high change, which I think she will bring that story to us today, and that's going to be exciting. Neil Ferguson, a fellow Scot, probably our leading economic historian in the world right now, and I'm very excited to meet him and hear his message about what the sort of killer apps are of transformation in civilization, and then, of course, we're going to hear from Maureen Bisignano on Saturday, and she will, I think, really tie it all back to how we actually do our work and why we do our work. And of course, George Will, who, is an incredibly savvy observer of the political scene. And I think obviously it's a big year politically, so his thoughts will be important too. But the keynotes are not just what we have, as you know, but I'm particularly excited by this year's lineup.
And it's a great lineup, as you said. And as we look at some of the breakout sessions, the theme of this year's meeting is how we get to that proverbial second curve, which you've written about quite a bit. As you travel across the country and even the world, what are the key challenges you're seeing hospital executives face? We've got some certainty with health reform now, but what are the key challenges for getting to that second curve?
Well, I think, I think everybody has clarity now about what they're trying to do. There's some uncertainty about the pace of change, and we're still going to have an election, and we're going to have a big budget discussion next year nationally. But the Supreme Court decision, I think, has sort of reaffirmed the fact that I think was going on anyway, that everybody is sort of pursuing a strategy of integration, and that's the mega trend, if you like. What I think people are struggling with out there, as I rattle around the country, is they get the PowerPoint, right? They understand the PowerPoint. They all sort of read the PowerPoint, seen the PowerPoint. It's embedded in their strategic plan. What they're struggling with now is, how do I make that happen? And particularly the migration of the business models from the old first curve of paying for volume to paying for value. And it sounds easy when you say it as a consultant, and I do it all the time. It's a lot more difficult if you're an executive trying to make the math work, moving from the first to the second curve.
Great. And lastly, and you're about to chair a discussion about new partnerships that are evolving in healthcare, whether it's with hospitals to hospitals, or hospitals insurers, or hospitals and the private sector in terms of private equity. What are you seeing in terms of the trend in that, and what's the impact going to be on the field?
Well, I think I'm really excited, and we're just going to start shortly here with a great panel. I've been working with my friends at KPMG. Ed Jeanette will be here to share early results of a big survey and big piece of work that they've been doing, and in joint partnership with my partners at Harris Interactive. So we've got some fresh new survey data based on interviews with leaders not only in the hospital business, but in the health plan business and the pharma medical technology business. And what I would say, is that we're seeing a time of high change. There's a lot of partnerships going on. There's a lot of mergers. There's a lot of consolidation. There's a lot of new integration, not only between hospitals and physicians, which we'll talk about a lot today with Jacques Sokoloff and Dave Lawrence and others, but we're also seeing some interesting deals being done. The Optum Monarch deal, which we'll talk about in a breakout. I've got my friends from Optum and Monarch coming later on during the meeting, and we're going to have a discussion about what they're doing. Big announcements with DaVita merging and purchasing Healthcare Partners, and very close to Bob Margolis, who runs Healthcare Partners, and so I have some thoughts on what that means. And we're seeing, private equity really come into healthcare again in a big way. And Fred Hessler is going to be our panel this morning. And Fred is an old friend and certainly probably the leading banker in healthcare, and can really give a perspective on what kind of deals have been done and why. I think it's a very exciting time in healthcare, and I think this discussion this morning will really get into some of the new business relationships that are emerging in this time of high change.
Right. Well, it should be an exciting meeting, an exciting 3 days here in San Francisco.
Yeah.
So I'm Matthew Weinstock reporting from San Francisco. We'll have more coverage from the Health Forum AHA Leadership Summit in Friday and Monday's editions of H&HN Daily. Thanks.